In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
Allergies against ragweed are a challenge even for allergy specialists. Dr. Hartmann, thank you for inviting me into your hospital. What's so special about this kind of allergies?
Well, we saw it coming up in the last years, and we have a long time where these pollens are in the air and they make severe symptoms for the patients for months in the year.
In my surgery, I always see patients with allergies, and I've got the feeling that the patients are getting older and older before they develop the first symptoms of a pollen allergy. Can you share this opinion?
Yeah, absolutely, and all specialists can share this opinion. We see it in asthma, we see it in atopic dermatitis, and in pollen allergies.
So you've got any idea why this is so?
We have a lot of ideas so far, but nothing is proven. So we cannot say exactly why this happens, but we see it. As I said, every specialist can confirm your opinion.
And if I send you a patient for treatment, for instance, so what do you do with the patients if you like to treat pollen allergies?
Well, first thing we have to do, we have to have a good talk to the patient to find out in what time of the year, in what settings he has his symptoms, so that we can find out what probably is the cause of the symptoms. And then we do some tests. And together with that tests and this long talking in the beginning, we can make a diagnosis and then the treatment.
And you can treat the symptoms of the allergy on one hand, and the other way to treat is to treat the allergic reaction specifically for the pollen you're against. So if you use, say, medication just to lower the symptoms, aren't there any side effects?
Yeah, they have their side effects, but in the last years things getting better and better, so we have better treatment for the eyes, better treatment for the nose, and better antihistamines that don't make you tired anymore. You can drive a car, you can even fly a plane with it, so good news for your patients.
And if you've got a patient who would say, well, I tried to treat my allergic symptoms with this kind of pills, say 5 or 10 years ago, and I wasn't getting any relief, are the newer pills and medications more specific and more helpful?
Yeah, they are more helpful. We talk about the third generation, and in this third generation we have a lot of different substances, and you will find a good solution for any of the patients, I'm sure.
So if you want to get rid of an allergy altogether, say you're allergic to some tree pollen and you want to get rid of the allergy, there are ways to do this, aren't there?
Yeah, we have this possibility since a lot of years now, and when we can do it, we can help this patient to not only cure the symptoms and to help them to get rid of this allergy.
And are there any side effects you have to look out for?
During this period, you have to be more or less healthy because your immune system should not fight, for example, against a regular infection when we do this. So you have to be healthy, then we can do our shots or drops, and then we can help you.
Dr. Hartmann, we're here in the Allergy Lab. We're doing all this allergy testing, and there's a skin test being performed. So what do you do with that?
Yeah, you can see there our medical assistant Susie is doing the testing with our patient now, and she brings on the skin the substances we think he might be allergic to.
And then you're doing with the substance what? You just leave it on the skin?
Yeah, first you bring it on the skin, and then you do a little stitch to present it to the immune system.
So you're putting the substance you think that the patient is allergic to into the skin of the patient. And what happens then?
Your immune system is reacting to the substances, and that you can see on the skin later on.
But isn't it dangerous if I just take the substance and put it into the patient, that he might go into shock?
It's not without any danger, and we are ready for these emergencies, so we're doing the test here, emergency ready.
So if you suspect that the patient is allergic to birch pollen, for instance, so you put some birch pollen onto the skin, stitch it into the skin, see some allergic reaction. Does it mean that the patient is actually allergic to it?
Yeah, the first thing we do with the patient is we talk to him. And if the patient tells us, yes, I have allergic reactions like rhinitis in May, in April, then we think it might be the birch. But when the patient says, no, I don't have it, he just has a sensitive skin for it, a sensitive immune system. So we have to find out if only sensitive to it or really allergic. That's why we need the talking to the patient, not only the tests.
Can you actually prevent allergies? So if I would be a dad and I've got a child and I want the child to raise without any allergic symptoms, can I do something to my child that is not getting allergic?
Yeah, we have a few things that we can mention so far. Not smoking in your rooms would be a good idea.
So like passive smoking?
Passive smoking is not a good idea for your child, for getting allergies. Breastfeeding is a good idea, 4 to 6 months. And for example, having animals in the house is a good idea. And live far away from big streets and have more children is a good idea.
Having more children is a good idea. Yeah?
Yeah, having brothers and sisters prevents you.
So living on a farm would really prevent allergies?
Yeah, that's what we can see in the data, but in the middle of Berlin this is hard to realize.
We got a viewer question from Croatia. Anna Odlos wants to know that she says she sees a lot of people with pollen allergy who are drinking herbal teas and eating honey. And she asks herself, is it a good idea to drink herbal teas and eat honey if you're allergic to pollen?
That's a very interesting question because in honey we find pollen. We even say where the bee lived because of the pollen. But usually you don't have symptoms. If you have symptoms for herbal tea, honey, whatever, please avoid to drink it.
Thank you so much for inviting me into your clinic.